Good evening. My name is Dlukejackson, candidate for DBA 870, and this evening I'm presenting my SOARS presentation for my dissertation on the topic Leadership Styles that Impact Emergency Preparedness in Long-Term Care. My primary mentor is Dr. Jarrett, and I have an overview of the topic, the overview of the management problem. The Centers for Medicaid and Medicare Services, there has a all hazard emergency preparedness checklist that all long-term care facilities registered with them follows, and the administrators are the ones who are responsible for enforcing the policies and based on the guidelines from CMS, all hazard emergency preparedness, to ensure that the facilities are in a state of readiness. And the facilities have been experiencing extenuating circumstances which impede their ability to prepare. These range from leadership, staffing shortages, and finance. So the purpose of this research is related to the poor performance of the emergency preparedness plan, and the research was conducted using evidence-based management. It deals with the type of leadership, the leadership styles that are required, that are most effective based on the research that I've conducted so far, and the leadership styles in this research related to the traits or characteristics of the leader. And the research will produce recommendations, is the expectation to produce recommendations that would be able to impact better decision making, which will improve emergency preparedness and develop an effective emergency plan. The research question and the CIMO framework. The research question is, what is the relationship between managers' leadership styles and emergency preparedness in long-term care? And the CIMO is depicted there with the content, the intervention, the mechanism, and the outcome. The theoretical framework or conceptual framework that I've developed thus far is follows the systems theory, systems thinking, strategy or framework, and it's the inputs from because long-term care is a complex system. It's actually, that is why I've chosen the systems theory, because it is a system, because it operates in all the different departments. They're all operate as one. It's required to operate that way for effectiveness to run the facilities, and the interactions of one department with the other is vital to the organization's success. So I've chosen systems theory, and with the research question, there the leader or leadership is the paramount, is needed. It's vital to the success of any organization, and in especially long-term care facilities. Therefore, the leadership drives the system, or it drives what the outcome would be, and the leader there communicates with the team, and in turn the outcome is the emergency preparedness. So it depends on the leader to set the tone for the success of the process. And in so doing, communication is involved, there is coordination, there is training, and there are several parts that has to be in place for the system to work effectively and for, in this case, the long-term care facility to be adequately prepared or having an effective emergency preparedness plan. And the stakeholders are the external factors, or they're outside. They can include the state, the federal government, the Centers for Medicaid and Medicare Services, who are responsible for executing the long-term care plan. And of course, feedback is vital to the system. The methodology uses systematic review, and there are 7 steps that it follows, mainly research question, the search strategy, conducting the research, screening the studies, the quality appraisal, data extraction, and findings. These are the search strings that were used in the search strategy, and it was mm, done with the help of a very dedicated resource that we have. And so I was able to come up with these that helped to find the literature to conduct the study. The inclusion and exclusion criteria are basically not very elaborate, but the literature, scholarly, peer-reviewed in English, and I chose between 2008 to 2021 because of the hurricanes. It's Sandy, well, it's not Sandy, but Katrina and Irma, and the other hurricanes were around that time, or the literature that I've seen started around that time, so that's why I've chosen the year 2008. And if it wasn't in English, it was excluded, basically. The quality appraisal, for the quality appraisal, I used to PUPAS. I started with lots of, after refining the search and all of that, I was able to bring it down to a sort of manageable number, and ended up with 39 articles that were included, that will be or is included in the study after elimination. And for the preliminary findings thus far, I have seen, although it is still in process, that there were reoccurring some terms that were reoccurring, and those include communication. Communication is vital for emergency preparedness, because if we look back at the recent fiasco, or the recent public health pandemic we had with the COVID-19, we can see how communication played a role in misinformation. So leadership style in that case also, the leaders can drive what the message is, how the message is received, and what is disseminated. Training is also vital. In this case, preparing for the pandemic, and you could never be adequately prepared because one never knows what would turn up. The other area of interest, or the area of vital importance, is coordination. There's need for coordination in every level, among facilities, within the facility, among the local leaders, the fire first responders, the FEMA, at the FEMA level, and at every other level. There is need, it's vital to communicate. and coordinate, and finances is also vital because there is need for finance if the process would be successful. And the implication for future research, so far this is still a work in progress. Budgeting, because some of the facilities are small and thus they are not tasked with, they are limited in terms of their financial ability. And it um, in this day and age that we live in, the electronic and electronic communication in terms of the internet, and that's vital to the success. So budgeting is a vital aspect. Human research in terms of staffing and policies and procedures, with, it involves a lot in that so far I've seen. And the limitation, well, Anne was the only one there during the study, and so that can introduce personal bias. Also, there is need for more scholarly research in this area, because I've found that, there was more on the clinical aspect, but less on the management side. And so with that brings a need for more research in the. Thank you for listening. And here's my email. You can send questions, send uh, anything that you think can be helpful. I appreciate your time. Thank you. Good night.